today with Brian Degenhardt. It's very nice to have you here. Thank you for agreeing on this interview. Brian is the Assistant Vice President of Osteopathic Research at the A.T. Still University and the Director of the A.T. Still Research Institute of the Kirksville College, both in Kirksville, Missouri, in the U.S. So, his main topics of research are the reliability of palpation and of osteopathic manipulative treatment. And he developed the Advancing Skills in Osteopathy program, which teaches osteopaths to improve the palpatory skills. We just heard that you do a lot of work on palpation, and Edward Stiles mentioned it yesterday also. But here at the conference, you do a workshop on the art of observation. So not palpation, but observation. Could you tell us more about it, the art of observation?
Certainly. So, Dr. Still, he developed osteopathy through his powers of observation. He had an experience that led him to be very critical of the medicine that was being applied at that time. And probably as a result of losing his family due to illness when he was in his 30s, he probably went through a period of depression where he was trying to search for a better solution to manage the diseases of his time. And he began through observation, and observation is the beginning of science. When you see certain patterns in your observations over time, then you develop certain theories. And his theory ended up being one that was called the lesion theory. That somatic dysfunction was an important factor in how the body was able to maintain health. And so he saw osteopathy as a science, and for 125 years that has been now taught throughout the world in a system similar to how Dr. Still taught. He basically provided background information about the anatomy, the physiology, the pathology associated with whatever was being taught, and then demonstrated skills that he, through his observations, seemed to be beneficial to help the body to recover from its illness, to gain better health. And then the osteopathic students had to then try to figure out how to recreate what they witnessed, to bring together the various information that he presented through his lectures, through an anatomic dissection, and then through watching the procedures of how he performed techniques to figure out how they were going to pull all of that together and reproduce that in a clinically effective manner. The reality is, in the 21st century, we are, as healthcare practitioners, we are being challenged to provide an evidence-based practice. You know, what is the evidence that what you do makes a difference? Unfortunately, over the 125 years, we've done very good in expanding the art of osteopathy. We've not been very good in expanding really the science of osteopathy. And that science really involves understanding what we do with our hands when we touch that patient. And that's been a very important part of my research at the A.T. Still Research Institute. How can we better understand what's going on in our hands when we touch that patient? And we have pulled together over $500,000 of modern instrumentation to help us understand what's going on when we touch a patient, to expand our observational powers as we learn osteopathy, and to provide immediate objective feedback to the student to help calibrate and understand their skills. So that's an introduction to kind of the work that we have been doing and what we're presenting at the conference here.
Mm-hmm. So the other workshop you teach is on working on the lymphatic system. So how important is the treatment of the lymphs during an osteopathic session, in your opinion?
The lymphatic system is critical in sustaining health. And it's important to think about us not as a single individual, but really as a collection of over 10 trillion cells. So really, when we look at our patient, we have to see them as a universe in and of themselves, and not just as an isolated individual. And so the health of each cell is really dependent upon the environment in which it lives, and that is the fluids, the intercellular space, the fluid around the cell is really what determines its health. The circulatory system brings nutrients to the cell and also removes them, but it is unable to remove the larger components of the molecules that are around that cell. And that becomes particularly important when you think about illness, infection, and trauma. In both of those situations, there are a lot of cellular debris, molecules, that are way too large to be picked up in the venous system. And the lymphatic system's purpose is really to clean out from around that cell all of these molecules that, if they stay around, will actually distort how that cell is able to function and result in disease over time. If that lymphatic system is not able to clean out those molecules, then it sets up an environment for illness and disease. And so that's why it is so critical that we understand how it works and how we can interface with it with our hands to optimize the health of the individual.
So do you use special lymphatic treatment techniques, or are you just saying, I always treat the lymph by improving mobility or something else?
Yeah, I think we treat the lymphatic system every time we touch a patient. The patient treats their lymphatic system every time they move, because the biggest driver of the lymphatic system is really the repetitive contraction and relaxation of tissues as a result of motion. And so certainly that is what we do every time we touch the patient and treat the patient. And it is also what the patient does in their everyday life. What becomes a problem is when somehow the structure has been twisted or distorted that inhibits the ability of tissues to compress and relax and cause the fluids to move in the body. Stagnation is the problem that is underlying many disease processes. And so every time we relieve dysfunctions, whether it is on the bony level, muscular level, ligamentous, tendinous, connective tissue level, we are always having influences on lymphatic system. When there are times, though, when, particularly like after surgery, where we have disrupted the lymphatic system and the channels have been altered, that the body can't just naturally move the lymph through the system. And then we also need more specialized techniques to manage that. And certainly osteopathy has many techniques to do that.
You will hold a lecture in a few minutes about the being an osteopath in the 21st century. So you just mentioned it before, but could you tell us something more about the challenges an osteopath is facing in the 21st century?
If we look at the challenges, I think there's two factors that are involved in our challenges. To me, there are two things that are driving healthcare in general throughout the world. And both of them are human constructs. One is related with economics, and the other one is related with science. These are both systems that we've established and as humans, and unfortunately, often economics is the factor that makes choices as to how we care for people. But the other is science, and a lot of times science can can alter the priorities within the economic system. And that's why it's so important that we as osteopaths engage in science in the 21st century, because it is science that's going to help to alter how humanity chooses to spend its money to provide for the health care of its people. In the 20th century, science was performed in what we call the ivory towers, the major medical institutions throughout the world. And it was the randomized controlled trial that was in the 1950s became kind of the gold standard, the goal for science in medicine. Unfortunately, as the 20th century finished, we also realized the limitations of that model. That a lot of times within the ivory towers, we did research on very selected people that we very specifically identified so that we could have very rigid controls that we could then perform one thing on and see if it made a difference. The reality is that the outcomes of that science really didn't translate very well into clinical practice, because the people that they were doing research on weren't the people that we were dealing with every day in our practices. And so the 21st century is really challenging us to how do we do research where medicine is being done, and that is within all of our practices, within our clinics. With the 21st century, science has developed tremendous technologies in order to collect a lot of data. In fact, we can, with a push of a button, I can collect more data than I can manage in years of full-time work as a scientist. The issue is, how do we, as clinicians, use these technologies to collect information on our patients that are meaningful, that will help to guide our choices to provide the best health care for the patient. And I really think that osteopathy has a very significant place in the 21st century to develop this type of science. Because through the 20th century, we have always prioritized the patient in our care. We developed very strong relationships with our patients, and as a result, our patients are very dedicated to helping us to understand the work that we do. And so by building a system that allows us to partner with our patients to look at the effectiveness and the safety of osteopathic manipulative treatment in the 21st century, I think will significantly guide the future of healthcare. One model of research that has been established over the last 50 years is practice-based research networks. So these are clinicians who recognized in their practice that even though they were taught well to practice medicine, that a lot of times, even when they did what was best, it wasn't as good as they thought it should be for their patient. So they recognized that there's still a lot to be learned in the practice of medicine. And so they teamed together and generated questions that they could answer within their practices. And at the Research Institute in Kirksville, we've developed a practice-based research network called DO TouchNet. It is now an international practice-based research network. We have over 380 members on 5 different continents, 12 different countries, that are collecting data into a central repository to help us then ask questions about the type of work that we do, the type of responses we are getting from our patients, what is effective, what is safe, what might not be as effective or as safe as we think that they are. It is these very large databases that are going to allow us to understand what groups of patients should be treated in what manner. And that is the real opportunity that we have in the 21st century, is that we can collect observations like we've never done before. Observations from patients, observations from their clinicians, and put that together and from that database ask questions that will give us far greater insight than we've been able to do in the last 125 years of osteopathy that will then help to guide the future of healthcare.